I'm Dr. Jason Bowlds. I'm a general surgeon, and every week I try to bring you videos discussing the treatment and prevention of diseases that affect the abdomen. Our topic this week is gallbladder disease. First off, what is the gallbladder for? Well, your liver and your pancreas work in conjunction to make enzymes, which then help you digest the food that you eat. Your gallbladder is simply a reservoir off of your liver which helps store some of these enzymes. Once you eat, your gallbladder then contracts and pushes the bile into the digestive tract to help you dissolve fat. The next question is, how does the gallbladder go bad? The typical scenario is there is a decrease in the function of the gallbladder, or there is a blockage in the outlet of the gallbladder so that it can't empty. There is stasis in the bile that sits in the gallbladder, and eventually this turns into sludge and can crystallize into stones. These stones can then block up the pipes which lead out of the gallbladder. Once a single or multiple stones are formed in the gallbladder, then these stones can then block the outlet of the gallbladder, causing it not to be able to empty. Once you eat, especially greasy or fatty foods, the gallbladder starts contracting against an obstruction, and this is what causes pain, referred to as biliary colic. The pain can occur at the top of the abdomen, sometimes in the right upper quadrant. It often radiates to the chest or the back and is associated with nausea or vomiting. Biliary colic usually lasts 30 to 60 minutes. Pain lasting longer than 6 hours is concerning that there may be a stone lodged in the pipe of the gallbladder, and secondary to bacteria in the GI tract, the gallbladder is getting infected, a term referred to as acute cholecystitis. Pain lasting longer than 6 hours, you should address this with your doctor immediately or go to the emergency room. Next, we'll discuss how do you find gallstones. If you are having abdominal symptoms and you are concerned you may be having gallbladder problems, you should seek the advice of your primary care doctor. They would usually order an ultrasound of the gallbladder, which is the best way to find gallstones. Sometimes gallstones are found in tests that were ordered for other signs or symptoms. People who are asymptomatic and not having abdominal symptoms but are found to have gallstones on other studies usually do not need surgery. Asymptomatic stones are present in a large portion of the population and can be left alone until they become symptomatic. But if you are found to have gallstones and you are having abdominal symptoms, then you should be referred to a general surgeon to discuss whether or not these need to be removed. So how do we remove a gallbladder? There was a shift in the late 80s which saw the removal of the gallbladder go from an open operation requiring a large incision across the upper abdomen to a laparoscopic procedure requiring only 3 or 4 small incisions. What used to be a 3 to 4 day stay in the hospital and a 4 to 6 week recovery is now an outpatient procedure with a 4 to 5 day recovery. Typically, a gallbladder operation lasts for 1 hour, during which time you will be asleep under general anesthesia. 4 small incisions are made and the gallbladder and the gallstones are both removed. Usually only a few teaspoons of blood are lost, and a blood transfusion is usually not necessary. Afterwards, you are taken to the recovery room for approximately 1 to 2 hours, where once you are awake and your pain is controlled, you will need a ride home. The risks of gallbladder surgery, like any major surgery, include a small risk of bleeding or infection. There's also a small risk of injury to the bile ducts, the small pipes which drain the liver and run behind the gallbladder. During the recovery from gallbladder surgery, you will probably not feel quite yourself for 4 to 5 days. During this time, you might be uncomfortable, you might have nausea or decreased appetite. And during this time, you should be on a very bland diet. After the 5th day, you should be feeling back to yourself. Most people take approximately 1 week off from any light duty work, but you will probably be off for approximately 2 weeks if heavy lifting is involved with your work. There's also something called post-cholecystectomy syndrome, which develops after the 2nd or 3rd week after your gallbladder is removed. Approximately 10% of people who have their gallbladder out develop more diarrhea or loose stools, especially after eating, once the gallbladder is removed. This can be a short-term problem, or this can be chronic. Of course, 90% of people don't develop this disease. If you are having problems with your bowels several weeks after your gallbladder is removed, make sure you let your surgeon know. There are several drugs such as cholesterol or cholestyramine which will stop this side effect. Lastly, I would like to discuss something called functional gallbladder disorder or biliary dyskinesia. These are patients who have biliary type symptoms but no gallstones on workup. Just know that over the past several years, the data showing the response to these patients with cholecystectomy shows that less than 50% of these patients get better with gallbladder removal. Therefore, it should be a diagnosis of exclusion. Patients who are found to have no stones on workup are often sent for a nuclear medicine study called a HIDA scan. And if this HIDA scan shows the function of their gallbladder is less than 35%, they are often referred to a surgeon. Just remember, this is a diagnosis of exclusion, and many surgeons will require that you've had an upper endoscopy and or a CT scan to rule out other pathology before turning towards surgery. So if this topic interests you, subscribe to my channel below. And in the comments section, please add any topics that you would like to hear more about in the future. As always, I'm Dr. Jason Bowlds, bringing you better health through better education.